Welcome to Vitalio. I'm Dr. Ben Lerner. We're now in a series on new patients. Everybody needs them, everybody wants them. Sometimes they're difficult to get. And today we're going to talk about referrals with our expert, Dr. Greg Miller. Let's get started.
Today we're going to be talking about referrals. I thought maybe the first thing we should do is look at what is a referral. If you go to the Googler, referral marketing is the method of promoting products or services to new customers through referrals, usually word of mouth. Such referrals often happen spontaneously, but business can influence this through appropriate strategies. So when I did that and I Googled referral docs, I got literally thousands of pages on Google of blogs and YouTube videos and just a plethora of different opinions out there about referrals and how to increase referral activity in your business. So what does that tell us? That tells us referrals are very, very important for the growth of a practice. And that's really what our series is about, is helping you as chiropractors grow your practices and grow your businesses. So clearly, referrals are an important part of that process. But why? Why referrals? Why is a referral a fantastic patient in your office? I don't think I have to let you think about that for very long. One of the things that we know right away is that they already know who you are. Somebody has told them, this doctor can help you. This doctor is a specialist. And if those are the exact words that come out, so much the better. But in the end, someone has told them that you are either a specialist or that you are someone who's capable of helping them determine the cause of their problem. That's why a referral is a fantastic patient to have in your office. So here's the problem. Your patients typically have never been taught how to refer. Now, what I mean by that is most of the patients that come into our office have been, typically before they come to you, they've been to an MD's office. Here's a secret. MDs do not have to teach patients how to refer. MDs already have a referral mechanism built into their system. I have a friend of mine who is an internist. He sees his responsibility, his job, as to see his patients on a yearly basis, give them a clear bill of health in his world, or if they have an issue, they come in, they see him, and he determines who does this patient go see. Do they need to see a dermatologist? Do they need to see a podiatrist? Do they need to see an oncologist? So he automatically makes that referral within their system. And then the doctor who receives the referral just naturally expects those to happen. Well, guess who's missing in that formula? Chiropractic. Now, that's a whole nother video that would take us on a very different rabbit trail. But it's important to understand that we are typically not a part of the MD's referral system. So guess who gets to teach their patients how to refer? You do.
Hey, we'll be right back with the rest of this material. But as a reminder, check the description for links to our podcast, YouTube channel, upcoming webinars, and other ways to get our contact regularly. I want to share this quick story with you really briefly from a doctor who has worked with Vitalio, and then we'll get right back to the content.
Dr. Logan Rush here from Clever, Missouri. I just wanted to take a few moments and speak with you about referrals here in our practice. Ever since we opened our doors here 4 years ago, and that's been a huge driving force for us. One of our major focus points has really been working on getting members of the entire family in. We really make sure that if mom and dad are under care, we do our best to try to get the kids under care as well. One way that we've had success in doing that has been through using the Gifts of Health, and that seems to work really well. Another area that we really focus on with driving referrals is the patient testimonials or the success stories. We use those, and quite often we'll post those to our Facebook page, and that really seems to be a great source for new patients as well for us. These are just a few of the areas that we've had some success in, but we just really try to make sure that we're active and listening just in our daily conversations and our 5-point office visits, and really just try to cue in on the fact if someone says something about that, making sure that we write that down, we keep that logged, and at some point bringing that back up in conversation with the patient. These are just a few things that work for us, but there's many avenues for reaching those new patients.
All right, doctor. So let me ask you a question. Who refers? Which of those patients that you've been taking care of for maybe days, weeks, months, or years is going to actually be the one that refers a new patient into your office? Give you a minute. You probably said the one that doesn't have headaches anymore, or the one that doesn't have low back pain anymore. And we'd like to believe that that's the case, but the truth is that patients refer because they, number one, like you, and number two, trust and respect what you do. It's not because you're a great adjuster or because you get fantastic results. That hurts to hear, but it really is true. We've been watching this happen for years and years and years. So let's talk about creating a referral culture in your office. Why would that be important? Well, it starts with an expectation. Hear me here. It starts with an expectation that every patient refers, and many refer more. If you start your practice day repeating that, and maybe that's the only thing you do, I promise you, you will see an uptick in new patient activity, because it's an expectation that not only you're placing on your patients, but you're placing that expectation on your office, you're placing that expectation on your staff, and most certainly you're placing that expectation on yourself. How do I do that, you ask? It's probably a whole nother video, but go ahead and Google affirmations. If you do that, you're going to find out how important it is to do things like having expectations for referrals. Affirmations is how you start your day, and it's important not only for you, for your patients, both the ones that you have and the ones that you're going to be seeing as new patients, but it's also important for your staff. More on that in just a second. Is your office a place where patients want to be? Do you do a morning walkthrough? In other words, this is the place where you put those expectations into your office. Are you walking through your reception area? Are you walking through where the staff is and placing an expectation on new patients calling into your office? Are you walking down that hallway where the new patients go into your consultation room and into your exam room and into your x-ray room? Doctors, how a day starts is how a day goes. And don't kid yourself into thinking that that's not an important part of referrals into my office. How about staff meetings? You should be having a staff meeting every morning that talks about the patients that are coming in, and it also talks about referrals and the importance of that. It should be absolutely a part of every morning staff meeting, and it should be a part of every weekly staff meeting, a much bigger part of every weekly staff meeting. That's how the staff is involved in this process and how they have expectations of patients to refer. I'm sure you've had occasions where staff has told you something about a patient that you didn't know, that the patient had never told you, but they did share it with the staff. We need to teach our staff how to be a part of this process as well. So let me give you a couple of things that you can, take with you at the end of this video. But the first one, and probably the most important in this whole process, is gathering testimonials. It's absolutely critical that your patient learns how to share their story. They need to learn how to share their chiropractic story. So you have to teach your patients how to do that. Do you have a system in place that does that? If not, then find one or contact us, because we'll be happy to help you do that. How about internal invitations? A mentor of mine used to tell me, Dr. Miller, the easiest way to get referrals into your office? And I'd say, nope, but I bet you're going to tell me. He would tell me, you just need to ask for them. And that may sound simple, but I have a friend who is a really good friend of mine, but on occasion he goes on site and does evaluations in chiropractic doctor offices. He told me about one occasion, and he said this happens a lot, where he spent the first 3 hours with the doctor as they were treating patients. So it's probably 9 to 12 in the morning. And he told me there were 6 opportunities for that doctor to potentially capture a referral into their office. So that's what I'm talking about when I say that, is you have to be present with your patients. You can't be thinking about the bills that may be on the desk. You can't be thinking about the next patient and what their condition is. You can't be spending too much of your time talking to the patients about weather or sports or whatever it is. You have to be focused on what's happening in that moment for that patient, and you have to be listening, because chances are they're giving you opportunities to capture referrals. I can't stress that enough. And then, like I said, teaching your patients to share their story. You need a process to do that. Using testimonials is a wonderful way to accomplish it. What about a patient appreciation day? This is another really, really important tool that we use to bring referred new patients into our office. If you've never done one of those, or you don't know how to do it right, again, reach out. There'll be some information on how to contact us at the end of the video. So we're talking about creating an environment for referrals. We want a warm and inviting office. Does the office appear expensive? When the patient walks through the front door, do they go, oh, wow, this may hurt a little bit? Believe me, doc, you want that to be the case. You want to make sure that everything in your office has the appearance of value, has the appearance of success, and has the appearance that encourages a patient to refer. Because remember, we talked about that. They refer because they like you and they trust and respect you. And certainly having an office with an environment for that is going to be important. I promise you that the cheapest guy in town will not have a referral-based practice. Your patients expect and demand value, even if they never say those words to you. Okay, we're about running out of time here. So as we close, please understand that a healthy office with the good systems in place should expect 3+% of last month's patient visits to be referred into the office the next month. Let me explain. If in July you had 500 patient visits in your office, you should expect, a healthy office should expect 15 new patients directly referred into the office in August. So 500 patient visits in July, 15 new patients in August. What's your care plan worth, doc? What are your treatment recommendations worth? Are you even giving your patients a care plan? Again, that's another video, but at minimum, we should be talking around $2,500 to $3,000. So let's assume you're closing 80 to 90% of those 15 new patients under your treatment recommendations or your care plan. Those would be averages that we would expect. Let's do the math. That's 13 patients coming under your care at $2,500 a patient. It's $32,500 worth of care from referred new patients into your office when you do it the right way. Doc, imagine the referrals that come from a new patient who comes in, they were referred in, and they understand the importance of referring. Hopefully in your mind you can see how this is really a snowball effect of growth in your practice. I am out of time. I'm happy to have a conversation with you. If you want to know more about how we do this, please reach out. The information is right there for you. Have a fantastic day. Now go and save some lives.
Hey, thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about Vitalio and how it might help your practice, you can always reach us at vitaliohealth.com. That's VITALLEO health.com. Bless you, and remember who you are.